There's a concept related to mental health and substance use disorders, which is called comorbidity or co-occurring conditions, or co-occurring disorders. And as a quick aside, co-occurring or comorbidity can also refer to multiple physical conditions occurring or multiple physical and mental health conditions occurring. But for this specific videos, I'm going to primarily focus on co-occurring or comorbid mental health and substance use disorders. These conditions don't always occur in a vacuum, and I always like that saying, this XYZ doesn't occur in a vacuum. Instead of these conditions being siloed or occurring in a vacuum, there is actually a comorbid or complex relationship between many of these conditions. Someone may have co-occurring mental health and substance use disorders that interact and compound each other, making an intense, complex cluster of symptoms. For example, consider two comorbid or co-occurring mental health disorders. Someone may have both generalized anxiety disorder and major depressive disorder. Their fear-based symptoms from their generalized anxiety disorder may present itself and make it difficult for them to function in daily life. Similarly, they may experience a constant, difficult, persistent, depressed mood related to their major depressive disorder, which also may cause difficulties as it relates to them in their daily functioning. And the intense overlapping and connectedness of these different symptoms from both conditions kind of impacting them, causing extreme distress and difficulty as they navigate their daily lives. Even the concept of co-occurring or comorbid substance use disorders. This could include someone having an opioid use disorder and a stimulant use disorder. Someone may decide to consume these substances, both an opioid and a stimulant. They may consume them both to kind of reduce the negative effects of the other one, ultimately developing a substance use disorder as it relates to both drug classes, an opioid use disorder and a stimulant use disorder. Co-occurring conditions is often used to describe when substance use and mental health disorders both are present. For example, someone may have post-traumatic disorder and an alcohol use disorder. As a potentially harmful and negative way of coping with their PTSD-related symptoms, someone may decide to consume alcohol, ultimately causing them to develop an alcohol use disorder as a negative way of coping with PTSD symptoms. Now, both PTSD and alcohol use disorder are present in this individual, and they have to navigate the cluster of both of these conditions impacting them, which may further compound the negative experiences that they have. And it could go both ways. A mental health disorder could develop before a substance use disorder, and a substance use disorder could develop before a mental health disorder. Now, with comorbidity and co-occurring conditions or co-occurring disorders, there's also this concept called dual diagnosis. And dual diagnosis largely refers to the condition being diagnosed. So someone could have a comorbid or co-occurring mental health and substance use disorder, but not be diagnosed with these conditions. Dual diagnosis is when someone is diagnosed with one mental health disorder along with another mental health disorder and or along with a substance use disorder. Dual diagnosis is basically just having multiple diagnoses that come from a licensed clinician. Now that I've introduced co-occurring mental health and substance use disorders, in the next video, I will describe how many adults in the United States have a co-occurring mental health and substance use disorder. Thank you so much for watching.